Hello guys. So now let us learn about forensic medicine and toxicology. So FMT and PSM, it is just like watching a movie. Okay. So just watch these videos like a movie. There is nothing much to learn. It is just to memorize. Okay. So just watch like a movie. You would be knowing all the stuff. Just I'm making you guys revise. Okay. Watch it like a movie. Okay. So now starting with FMT, it is gonna be sexual offenses. First we'll learn about it. Okay. So in sexual offenses, please remember the BNS. That is, for rape the BNS is 63, whereas for the punishment of rape will be BNS 64. Okay, remember these two values, 63 and 64. Okay, then coming to examination of the victims and accused. Okay, so victims and accused examination. Okay, this is what the questions have been all through these years. So let us see. In victims, we'll collect the artifacts, the clothes, the nail, and all the things that are there, the ornaments, etc., will be collecting from the victim. Okay, so then with examination, we'll go for hymen and genital swab examination. Okay, so the consent. If she's a minor patient, it is from the parents that we should take. Okay, so please remember, from the if it is a minor, from the parents is what we are gonna take the permission from. Okay, so with regards to hymen examination, please remember the point. The most common type will be semilunar type, and in children the hymen won't be ruptured. Okay, so please remember this. In children there won't be most commonly there won't be hymen rupture. Okay, the most common type will be semilunar type. Okay, then there is something called a false virgin. Please remember that there's something called false virgin, where the foreshed will be posterior commissure. Okay, so please remember that extra point. Okay, then coming to genital swab examination, so we'll take swab from the genital region and we'll be examining for semen, sperm, and the sperm motility will be examining. So the thing is, for semen, it is gonna be till 4 days we can examine them, and of sperm can be examined for 3 days, and motility can be checked until 12 hours. Okay, so till 12 hours the motility can be observed. Okay, so till 4 days we can get a genital swab and examine for semen. Okay, so this is the thing. Then coming to blood stains, we'll discuss. Okay, semen examination and blood examination. There are four types of examination. With regards to semen, it is going to be Florence test and Barbarius test, whereas for blood stain it is going to be Teekman test and Takayama test. Okay, so please remember these four names and the differentiation between this has been asked many a times in previous years. Okay, so this is a previous year question, so please go please paste it in your sticky note. Okay, so Florence test is gonna be the observation will be dark brown rhombic crystals will be there. Okay, whereas for Barbarius test it is going to be yellow needle shaped. Okay, so if you please go to Google and please get the images of Florence test and Barbarius test and all these tests, all four tests. Okay, please know the difference before entering the exam hall. Okay, then coming to Teekman and Takayama, so Teekman will be brown rhombic crystals just like Florence, but how do you differentiate? So it is gonna be the sample. So semen will be Florence, whereas blood stain, if the sample is given, then it is gonna be Takayama. That's it. So that is how you differentiate. Whereas Teekman's test. Okay, whereas Takayama will be pink feathery. Okay, pink feathery appearance will be there with respect to Takayama test. Okay, so this is the examination of a victim, whereas we'll see the accused examination. So it is a male, right? So what we'll be doing is vaginal cell detection test we'll do. Okay, so how do we do it? We use Lugol's iodide. Okay, so we'll take the swab from the accused genitals and we'll test for vaginal cells are there or not. We'll use the staining, that is Lugol's iodide. Okay, that's it. Then one more thing about sexual offenses, or with regards to sexual concern, is MTP. Okay, so that is less than 20 weeks 1 RMP is required. Less than or equal to 20 weeks, if MTP is being done, 1 RMP is required, whereas for 20 to 24 weeks it is going to be 2 RMPs, whereas more than 24 weeks it is going to be not routinely done but need a special exceptions from the court. Okay, from the court, the a special judgment has to be given with regards to more than 24 weeks of medical termination of pregnancy. Here the three persons that are involved are a sonologist, obstetrician and a pediatrician. Okay, so these are three persons. They'll give in option, is it lawyer, police and all. Please, that is the exception. Okay, so there they won't be there. Okay, lawyers, the police and all won't be there in this. It is going to be only three persons, that is sonologist, a pediatrician and a obstetrician. Okay, so beyond 24 weeks when MTP is being done. Okay, so this is an extra edge point. Then moving on to legal procedures. Okay, so there has been no questions that has been asked from legal procedures, but the specific thing was they were asking about the cross examination and these things. So let us see how it happens. Okay, so where exactly this cross examination and all will come. And one more thing, previous year question is McNaughton's rule. Okay, so we'll come back to that. So it is going to be the process of legal procedures will be, first there will be an inquest. For example, some murder has happened or some sexual accusation has been done. So what the legal procedure will be with respect to this criminal case, where the medical team also has to be indulged in. Okay, so let us see this. So first there will be inquest, that is police inquest and magistrate inquest. Okay, so police inquest will be 193 BNS, whereas magistrate will be 196. Okay, please remember this. Okay, then coming to then after the inquest we'll call the witness. Okay, so a witness will be called. So there are three types of witness, that is first hand, common witness, expert witness. Okay, first hand will be personally known. Okay, so he's seen the crime by his eyes, by his own eyes. Okay, so if it is if he himself has seen it, then it is going to be first hand witness. Then common witness is all the public that will be watching the crime. Okay, so for example, some murder is going on in a bus stand, so all the people who are in the bus stand will be the public, right? So they will be the common witness. Then the expert witness will be the doctors. Okay, so doctor, etc., all these people who has examined the crime and know that this was the finding that was seen in the body or something like that. Okay, so these are the expert witnesses. Then coming to after witness, it is going to be the evidence. Okay, so evidence will be the direct, indirect or oral documentation. Okay, then coming to examining of the witness, now we have to examine the witness, right? After calling the witness, these are the three types of witness that are there. So now we'll be calling to the court, so court will be calling them. Okay, so in examining both the for and fro. Okay, so both of them will be giving the witness examination. So direct examination is there, cross examination is there, and then the redirect examination is there. Then the court can ask the question. Cross examination is where both the parties can ask the questions. Okay, so this is where the examination of witness will be there. And please remember, there's something called conduct money, where the party that has called the witness will give them money. Okay, so will give them money for all the travel allowance, the stay and all. So the concerned party can give them. Okay, so this is conduct money. Then coming to summons, all the higher courts can summon. And please remember, when the summons is given to a doctor, for example, where to attend is the higher court, higher level of court is where you attend. And in criminal versus a civil case, it is going to be criminal that you are going to attend. Okay, so it is going to be higher court first, the priority. For example, high court has called you and the district court has called you, are going to go for district high court on the same day. For example, summons is given on that particular day, it is going to be the higher court that you are going to go and attend. And for example, in higher court also, if it is a civil case and criminal case in the same court, it is going to be the criminal case that you are going to go and attend first. Okay, so that is with regards to summons. Then coming to McNaughton's rule, it tells that for example, a crime has happened and he was diagnosed ill. Okay, so if he is a mentally unstable patient, then he is given the rule that is there is no offense from him. Okay, so nothing is offensive when it is a mental patient or a mentally ill patient that is doing the crime. Okay, so this is BNS 22. Please remember this BNS. Okay, so how will we test for the insanity? Okay, finally the court says that he has to be examined whether the patient is insane or not. So we follow Durham's rule and Curran's rule. Okay, so please remember these two names. This is how the doctor tests for insanity. Okay, when the court gives you the order, then that is with respect to the courts and all these things. So now we'll move on to the specifics of forensic, that is the identification. Okay, so first identification will be what are the things that we identify. Like for example, there is a body, so how do we identify in a crime, right? So one thing is age that we identify, then the sex of the body will identify, then the race of the body, and fingerprints is what we take. Okay, so these are the specifics of identification. So let us say one by one. So age, we're going to take bone age, right? So bone age, if it is a less than 13-year-old 13-year-old body that we are seeing, then it is going to be wrist or elbow, not only body. Okay, so if we are going to be some case is there, and if we want to prove whether he is a minor or a major, the person will be telling I'm 18-year-old, but we'll have to prove from the court, right? So that is when we'll take the x-rays. So this is how we'll take the x-rays. Okay, so if it is a less than 13-year-old, we'll consider wrist and elbow x-ray, whereas 13 to 16-year-old, it is going to be wrist and hip x-ray. Wrist and elbow, wrist and hip. Then coming to 18-year-old, if he's a major, then we'll confirm by clavicle, wrist, elbow, and hip. Okay, so this is how the bone age can be determined. Then coming to infant age determination. So for some infant age, we'll have to determine either the demise has happened, or for example someone has left the baby somewhere. So all these are criminal cases, right? So that is when we'll have to go for infant age determination. So this is where we follow Hayes and Morrison's rule. Okay, Hayes and Morrison rule, where we'll take the CHL. Okay, so CHL is nothing but crown rump length plus length of the lower limb. Okay, so crown rump length, we'll take it in the by the USG, right? So then we'll take the length of the limb also. So we'll add that. If the value comes less than 25, the age will be root of that value. Okay, if the value is gonna be more than 25, it is gonna be CHL by 5. Okay, so that is how we determine the age. Okay, please remember Hayes-Morrison rule. This is a previous year topic. Okay, so that's it. Then coming to dentition by the teeth. See, please remember this. They'll give you a chart and tell you what type of dental chart is this being followed. Okay, so the easiest method is, please remember this. If it is a universal chart, there will be double digits. Okay, so there will be two digits. Okay, 22, 23 in that way. Okay, then if it is gonna be Palmer's technique, there is gonna be single digit. Okay, single digit method is what is being followed. One in that way. Okay, so 1, 2, 2, 3, 3 in that way. Okay, so it will be followed in that way. It is going to be Palmer's method, whereas FDI method will be 11, 21, 41, 31 in that way. Okay, so you can easily identify that and tell which chart the dentition has been in. So that is what the question will be. Okay, so nothing else they have asked till date. So this is what the questions will be with regards to dentition. Okay, then coming to sex determination, we are going to take two main bones. Okay, two main bones, that is skull bone and pelvis. Okay, so these are the two main bones that we consider for sex determination with a skull. So for example, let us take some exhumation has to be to be done, like to determine what sex that body was supposed to be. So in that way, when the exhumation happens, so we'll determine the sex of this skull. Okay, I mean sex of the skeleton by these two muscles mainly. So remember male, and it will be easier for you to differentiate between female. Okay, so male, in the male, the skull will be large, rugged, supraorbital ridge will be prominent, and the orbit will be square. Just by looking at the orbit itself, you can determine whether it is male or female. Okay, and then the mandible will be broad as compared to the female skull. Okay, so that is the difference when it comes to female. Okay, then coming to pelvis, again male, it will be large acetabulum will be there, then ischial tuberosity will be prominent, then small and deep sciatic notch will be there. Here also it is deep. Okay, remember, deep sciatic notch. So this is how you differentiate between skull of a male and pelvis of a male. Okay, then coming to one more so for example, if we get a sternum, so general rule is that a male sternum will be more than 149 millimeter, meaning it will be more than 15 centimeter scales that we have, right? So male sternum will be most probably more than 15 centimeter, then whereas a female will be less than 15 centimeter. Okay, so please remember this with regards to sternum. Then let us go for a race. Here the races are negroid, caucasoid and mongoloid races that we differentiate. In mongoloid race, the important point is there will be shovel shaped incisors. Okay, so shovel shaped incisors will be there in mongoloid. Please remember this point. Then coming to dactylography, it is nothing but the fingerprint that we take, right? So any crime, it is whether it is a civil thing or a criminal thing, some robbery has happened, and we have to determine in other cases like whether this is the person that we were trying to identify. That is where we use dactylography, right? So you know that, right? In all the movies and all, they will be using some powder and with a brush. So this is black powder. This is called as black powder. It won't be black as we have seen in our movies. It will be white color. Okay, so the material that is gonna be is carbon and graphite. Okay, please remember this powder. Okay, black powder, but the powder will be white. Okay, so that is the thing. So what do we identify is the loops and whorls. Okay, so loop is nothing but one core and one delta. So okay, so for example, this is the thing, this is the fingerprint, right? So if you just take a look at your thumb, this is the thing. Okay, so if it has a loop, it is going to be one core and one delta meaning it will be like this. Okay, so just take a look and take a look at your own fingerprint, and you will be able to identify what I'm talking about. So if it is whorled, it is going to be whirling will be there. Okay, so whirling. Okay, in that way. So whorled. Then arch will be like this. Okay, arch will be like this. Then composite, it combines all these things. Okay, so in that way. So these are the types of dactylography that we do. And the major important point is, this was a previous year question, where the fingerprinting will be lost. Okay, so everyone has a fingerprint. That is a definite identification mark all of us have, and even in twins it will be different. Okay, so please remember this. So there will be cases where the fingerprints will be lost. So those cases are in rickets. In severe rickets, there might be loss of fingerprints. In celiac diseases, then coming to dermatitis, leprosy, scleroderma, here there will be loss of fingerprints. Okay, please remember this is an extra point. Okay, then coming to thantology, that is the favorites of us, right? So thantology, all the study of the dead bodies that we do, all the post-mortem and all. So this is called thantology. Okay, we'll be starting from the the post-mortem changes that occurs, and then we'll see how the dissection and viscera preservation is done when we go for post-mortem. Okay, so post-mortem changes can be classified as immediate, early and late changes, where in immediate changes there will be respiration and circulatory cessation. Okay, so immediately circulatory ceases, right? Circulatory system, the blood flow will cease because the heart is stopped. So this is the immediate postmortem change that we can see. Then coming to early is what is very important, that is algar mortis, liver mortis and rigor mortis. What are these? So algar mortis is with regards to temperature, okay, which sets in by 12 hours. Okay, so after the death, within 12 hours, with the 12 hours passing of time, so the body will be cold. Okay, immediately the body won't be cold. So after 12 hours, it is going to be cold. Okay, so there are exceptions where the body remains warm. Okay, so algar mortis won't happen and the body remains warm. So these cases are heat stroke, pontine hemorrhage, sepsis, and please remember strychnine. Okay, so strychnine poisoning. Okay, we'll come back to that in toxicology, but please remember, these are the places where the algar mortis won't happen and remains warm. Okay, so the body remains warm. Liver mortis, you know that, right? So discoloration behind the dependent area. Okay, so blood pooling will happen and this discoloration will be there. Then coming to rigor mortis, rule of 12 is there. Okay, so please remember rule of 12, where here the rule of 12 is that it sets in by 12 hours. Okay, rigor mortis is nothing but the clumping of the bones. Okay, sorry, clumping of the muscles. All the muscles become stiffened. Okay, so we cannot move the limbs and all, right, in dead bodies. So this is what rigor mortis, this is where the rigor mortis comes in. Okay, so the rule of 12 is it sets in by 12 hours, it remains for 12 hours and diminishes by 12 hours. Okay, so this is the rule of 12. Okay, so please remember that. Then other point that I want you guys to remember with regards to rigor mortis is it is the heart first, then eyelids, then the fingers. Okay, remember in that order. Heart is the first organ to get rigor mortis, then eyelid, then the fingers. Okay, it is in that order. Okay, this is the order that is required for rigor mortis. Then the late postmortem changes are putrefaction, adipose hair, and mummification. So here in putrefaction, the order is larynx, stomach, and then the organs. Okay, please remember in that way. So larynx is first, right? So larynx is here, then the stomach is here. So in remember in that way. Okay, so larynx and stomach putrefaction will happen. Then adipose hair, it has ammonical odor. Okay, if the baby no, if the body has not been properly decomposed, then it is going to be adipose hair formation will be there. So where the facial features will be preserved and the body has an ammonical odor. Okay, so this is gonna be there till from 3 weeks till 3 months. Okay, so please remember this dates. Okay, then coming to mummification, it will be odorless. Okay, so odorless body will be there. And one more differentiation is, see, for example, adipose hair looks like a kwashiorkor person. Okay, so we discussed in pediatrics, right? Kwashiorkor, pot belly and all. So it will be fat. Okay, because fat necrotization is happening, so that is where the facial features and all will be preserved, whereas mummification will look like marasmus. Okay, so you know mummies, right? So we have seen in all the movies and all. So that is how it looks like. It is odorless in mummification, whereas ammonical odor is seen in adipose hair. Okay, so this is the thing with respect to PM changes. Now let us move on to the sequence of dissection. So after all the external observation that we do in a postmortem body, we'll start the dissection, right? So remember, in asphyxia and poisoning, it is going to be head, thorax and abdomen that we do. Okay, head, then thorax, then abdomen that we do. Okay, so in both of the thing, the same thing. In asphyxia, after all these things, we'll do the neck dissection. Okay, so head, thorax, then abdomen, then we'll do the neck. Whereas in poisoning, it is the same. Okay, but the major difference is in fetal death, because we have to determine whether the baby took a breath or not. Okay, whether it was a stillbirth or a live birth that happened. Okay, so that is why we'll have to determine the diaphragm position. Okay, if it is so that is why we'll open the abdomen first, then the head, then the thorax. Okay, so HTA in asphyxia and poisoning, whereas for fetal death it is going to be abdomen first. Okay, so the thing is, in live birth, the sixth till the sixth rib, the diaphragm will be there because the baby has taken the breath and diaphragm has been come down, whereas stillbirth, the baby has not took a breath and it will be in the second rib position. Okay, so this is the thing with fetal death. So the most common incision that we do is I shape. There are other shapes also, Y shape, inverted T shape and all these things, but remember I shape is the most common incision that we do. Then coming to techniques of organ removal, there are 4 techniques. Okay, that is Virchow's technique, which is organ by organ will remove. Okay, so by organ will be start removing, whereas Letulus is en masse, meaning the entire organ tissue from the body will be removing at once. Okay, so not one by one will be removing as in Virchow's. Here in Letulus will be removing entire organ in one go. Okay, then coming to Gon's method, it is going to be in blocks. Okay, for example, thorax organs will be once and abdominal organ will be once, the pelvis organs will be once, in that way. Then in Rokitansky will not remove the organs, whereas and will be doing in situ. We'll be using these techniques in TB. If he was a suspected TB or HIV patient, we'll be doing these techniques. Okay, so in situ meaning we will not remove the organs where the infection might spread, right? So that is where we'll do in situ, inside the body itself we'll do the dissection and determine. Okay, so this is the thing with respect to removal of organs. Okay, please remember this. This should go for your sticky note. Okay, then coming to viscera preservation, this also should go to your sticky note because it will be confusing. Okay, so organs, it is going to be sodium chloride that we'll use. Okay, then for blood it is going to be sodium fluoride. Okay, then for urine thymol is used. Then for histopathological examination 10% formalin is used. Okay, so remember this. Okay, then when it comes to toxicology, if we are determining some poisoning, then we'll go for rectified spirits with respect to organs. In DNA analysis, if you want to determine whether he is the child of a father or something like that, so we are going to do DNA analysis where sodium fluoride, instead of sodium fluoride we will be using EDTA. Okay, so remember these 2 extra points. Okay, that's it with respect to viscera preservation. So now let us move on to the specifics or the injuries that might happen that will lead to the death of the patients. So the major traumas that will lead to the death of the patient, that might be criminal in a court. Okay, so we'll discuss one by one. So we'll start with asphyxia. So in asphyxia there are 2 types. Okay, so one is strangulation, the other one is suffocation. Okay, so strangulations are hanging, ligature, throttling and compression of the chest, whereas in suffocation it is going to be smothering, choking, gagging and drowning. See, the thing is, strangulation meaning around the neck, whatever the thing is there, it is going to be strangulation. Okay, so suffocation is where we try to block the nose and mouth. Okay, so we'll use something to block the nose and mouth is suffocation, whereas strangulation is we use certain things to block the neck. Okay, so that is why that is how the mechanism of asphyxia is, right? So we are basically blocking the airway. So it is going to be 2 methods that we block the airway, that is mouth. If we are using if we are blocking mouth and nose, it is going to be suffocation, whereas neck, if we are if we are using, that is going to be strangulation. Okay, so now coming to strangulation, the important thing I want to discuss is hanging. Okay, so see, remember all these things, strangulation and suffocation, they are asking the image based, or they'll give a specific terms to determine whether it is a throttling or whether it is choking or gagging. So this difference they are asking. They'll give an image and they'll tell what is this. So please remember, if it is if they say some someone is putting their hand and choking something, it is going to be towards the neck, it is going to be throttling. Okay, so please remember that term, throttling. Okay, So then gagging, choking and all, if you put something in the mouth, so that is going to be choking or gagging. So then coming to hanging, so it is going to be types. There are types of hanging, or the classification of hanging is this as it goes on. Also complete, incomplete, typical, atypical, accidental or homicidal. Okay, so these are the types of hanging. So here in complete weight of the body is what causes the complete hanging, whereas in incomplete the body touches the ground. The complete weight of the body is not which cause the death of the patient. It is going to be like body will be touching the ground, but due to the prolonged asphyxia, it is the death will be there in incomplete. So this is the difference between complete and incomplete hanging. So typical and atypical, if the knot that has been tied is in the mid occiput, then it is going to be typical, whereas elsewhere other than mid occiput it is going to be atypical. Okay, so if it is the skull and this is the occiput, so if the knot is here, then it is going to be typical. So elsewhere near the neck, face or in the front and all, it is going to be atypical. Then coming to accidental, this is very most common. So please remember the name Kurzweilism. It is a sexual type of sexual arousal where the accidental hanging might happen. Okay, then the other one is homicidal. So the person wants to kill and they'll hang the other person. Okay, so this is how the classification of hanging goes on. Okay, so coming to features of antemortem, so we'll have to differentiate between antemortem and postmortem hanging. Okay, so someone might kill a person and they'll hang the person to make it sound like it is a suicidal. Okay, but sometimes we'll have to they differentiate between the features of antemortem and postmortem hanging. So this is where the antemortem features are there. So there will be a dribbling of saliva. There will be left fascia sympathetic, which is a eye feature. Okay, so if this is the eye and this is the cornea, so what happens is there will be brownish discoloration just around the eye. Okay, so this is called la fascia sympathetic. Okay, this is in antemortem hanging. So then coming to ligature, it is going to be oblique or incomplete ligation. Okay, so ligature will be oblique or incomplete. So full around the neck the ligature won't be there. It is going to be only at the pressure points, right? So the knot will be here where at the pressure points only there will be ligature, whereas if it is a post-mortem after strangulating or causing some so that reason of death, if it is a homicidal, then it is going to be complete ligature. Okay, so this is the thing. Then in antemortem most commonly it will be above the thyroid. Okay, so above the thyroid the ligature mark will be there. Okay, so please remember this with respect to antemortem. So before that it has been the suicidal death. Okay, so remember in that way. So this is with regards to hanging. Then the important point with respect one important with strangulation was hanging. So the other important with respect to suffocation is drowning. Okay, so let us discuss drowning now. Here also there are classification, that is dry drowning, wet drowning, cold water drowning and post immersion. Okay, so let us see what is that. Okay, in dry drowning, so there is no water entry to the lung. Okay, whereas in wet drowning the water enters the lung. So that is the main difference. Then coming to cold water, there is immersion syndrome. Okay, where there is vasovagal shock. What happens is, so as we have mammalian dive reflex. Okay, so in cold water exposure, suddenly if the cold water is exposed to our face, what happens is there is parasympathetic activation. So parasympathetic is reduction in heart rate, right? Sympathetic, parasympathetic, we discussed, right? So reduction in heart rate. So what happens is there is a shock where suddenly the heart stops itself. Okay, so heart rate will be so low, it will go into bradycardia, so it will stop itself. So that is when the death happens. This is because called as cold water immersion syndrome. Okay, so this is the thing. Then coming to post immersion, so due to vasovagal shock the death won't happen. What happens is post immersion sometimes in people electrolyte imbalance might happen, okay, hypokalemia, hyperkalemia might happen and cause arrhythmia and leads to death. So this is post immersion drowning, okay. So drowning post drowning, we'll recover them, they'll be all right, but suddenly the death happens post after recovery. So this will be post immersion syndrome. So these are the types of drowning classification, okay. So remember an important point, that is pult of hemorrhage, okay. So pult of hemorrhage is where rupture of alveolar wall is seen, okay. So rupture of alveolar wall is seen in a pult of hemorrhage, okay. So then the major difference is freshwater versus saltwater drowning, okay. So why do we have to determine is someone go and drown in a river and the body will be found in the beach, okay, in the beach will be there. So that is where we'll have to determine whether the death the person drowned in a river or in the sea, okay. So this is where the differentiation comes in. So in freshwater drowning, it is going to be hyperkalemia, because see all the freshwater meaning, so there will be lower electrolytes as compared to salt water, right. So here the hyperkalemia will be there, and also hypokalemia can also be there, okay. Then chloride shift will be from right to left, then hyponatremia, right, because it is not a salt water, hyponatremia will be there, whereas in salt water it is going to be hypernatremia, okay. That's it. Then chloride shift will be left to right, okay. So there will be pulmonary edema with respect to saltwater drowning, okay. Please remember that. Then what is the test for drowning is Jettler's test and the diatom testing. So there are two tests that we do for drowning, that is diatoms, all the diatoms, if the person holds if it is a sea drowning, if it is a beach drowning, then it is going to be diatoms that we'll see for all the sand particles and all we'll be seeing, whereas Jettler's test we'll see for chloride concentration, okay. So this is drowning, okay. Then moving on to injuries, okay. So this is asphyxia, we have finished. Now we'll move on to injuries, okay. So in injuries, the most important thing is aberration, bruise and contusion. We should know the difference between aberration, bruise and contusion, okay. So aberration is just gazing out the epidermis, okay. There will be gazing out the epidermis. We all would have fallen from our cycle and all, so we all would have gotten aberrations, that is called aberration, okay. Whereas bruising is just below the epidermis, we'll be seeing the bluish discoloration, okay. So this is because of small vessel ruptures, okay. So this is called bruise. Whereas contusion is, so there is a skin layer, whereas below it there will be too much hematoma, okay. So too much hematoma is there, then it is going to be contusion. So this is the difference between aberration, bruise and contusion. Please know this, okay. They might ask you an example. So when it comes to aberration age, like we have to determine in some of the post-mortem cases, we'll have to determine whether the death happened because of that particular injury. So that is why we'll have to know the aberration age. If it is less than 12 hours, it is going to be raw, okay. Whereas if it is more than 12 hours, it is red. So the other colors will be, you know that, right. So when injury happens or aberration happens, we all would have got injuries. So this is how it goes, right. First it will be raw, then red, brown and then blackening of the scar will happen. So this is the thing with aberration aging. Then coming to bruises, to determine what type of blood has been below the skin, it is going to be, if it is red, it is going to be oxyhemoglobin, whereas if it is blue, it is going to be deoxyhemoglobin, okay. So then if it is brown, it is going to be hemosiderin, okay. So this is the thing with respect to bruise and bruise coloring, okay. Then contusion, so the most important thing is battle sign. They have been asking this many a times. So mid cranial fossa fracture is there, meaning it will go for battle sign. Battle sign, you know that, right. So just near the this is a mastoid process just behind our ear. So there will be bluish discoloration that happens, right. So why is this happening? Because just above that mid cranial fossa is there, anterior cranial fossa, middle cranial fossa and posterior cranial fossa. If some fracture is happened here, so it is going to be battle sign, meaning there has been blood vessel rupture that has happened. So this is with respect to contusion. Okay, so contusion is, I told you, right, blood collection, so it is going to be battle sign. Okay, so remember that. Then coming to some of the important factors with respect to RTA is sparrow foot, whiplash, seat belt injury, then dashboard injury. Okay, so sparrow foot is nothing but, so suppose the windshield has been shattered. Okay, so what happens is all the glass pieces will come onto the face and form these small cuts, right? So it is called sparrow foot. It looks like a sparrow foot, so that is why sparrow foot injury is nothing but windshield shattering. Okay, whiplash injury is vertebra. What happens is, just after an accident, so it sways like a whiplash. Okay, so that is when the whiplash injury might happen to the vertebra. Then chance fracture is, so suppose this is a vertebra, if the vertebra breaks in the middle, then it is going to be called as chance fracture. This happens because of seat belt. Okay, then coming to dashboard fracture, it is going to be posterior hip dislocation. We discussed this in orthopedics, right? Posterior dislocation. So how he is going to present with is flexion and internal rotation is how the patient will present with posterior hip dislocation. So this is with regards to RTS. Okay, so then coming to thermal injuries, we were discussing about all the injuries, right? So now coming to thermal injuries, so there are two things that I want you guys to remember, that is hypothermia and hyperthermia. Okay, hypothermia is when the temperature of the body is less than 35 degrees Celsius, where the management will be rewarming at 40 degrees Celsius. It should be slow rewarming, and it should be at 40 degrees Celsius maintenance. Okay, so postmortem, if it is a hypothermic body that we are seeing, there is something called as Wyszynski bleeding. Okay, in the body there will be something called as Wyszynski bleeding. Okay, please remember that name. Then coming to hyperthermia, the difference is, if it is more than 40.5 degrees Celsius body temperature, then it is called heat stroke. Okay, so here in heat stroke, there is no sweating. Okay, so there is no sweating. Please remember, there is no sweating. Okay, so there is no sweating mechanism even though the heat is high. Okay, that is called heat stroke. There is the postmortem findings will be heat stiffness will be there because of protein. Muscle is a protein degradation is happening. What happens is heat stiffening is happening, then hematomas will be there, then there will be fractures of the bone because of the heat. Okay, then there might be crow feet. Okay, so this is the thing with respect to hyperthermia. Okay, now moving on to firearms and ballistics. But before going into firearm and ballistics, please remember the crow feet and sparrow feet. Okay, so please do not confuse between the sparrow feet and crow feet. Crow feet is what happens in hyperthermia injuries. You can go and see an image of crow feet in crow feet injury with respect to hyper crow feet, meaning what happens is, if it is a face, there will be blackening with say for example, it is a hyperthermia injury, right? So all the smoke and all will be there, so there will be blackening of the face. Okay, so this is a blackening or charred face. Okay, what happens is, there might be some whitish thing that looks like a crow. Okay, so you just see an image of it and you'll get to know. Please differentiate between crow face and crow feet and sparrow feet. Okay, please do not confuse between these two. Coming to firearm and ballistics, from a gun there are 4 kinds of discharges. Okay, that is what we are supposed to know. That is, one is flame will be there, the fire, the smoke will be there, the unburnt gunpowders will be there, then the bullet itself. Okay, so flame causes burns, fire will cause the burns, then smoke will cause the blackening, the unburnt gunpowders will go and will be around the skin, which causes tattooing. Okay, then the bullet itself causes the puncture of the skin. Okay, so then around the puncture there will be grease collar or a aberration collar. Okay, so remember this thing. These are the 4 types of discharge: flame, smoke, unburnt gunpowder, and the bullet itself. Okay, because why is this needed? Is to determine what is the range of the firing that happened. Okay, so if it is a close contact or the contact to the skin, like point blank, they have held the gun and they have shot the victim. So if it is gonna be all four will be there, right? Because flame, smoke, unburnt gunpowder, and bullet, all thing will be there if it is a point blank. Okay, so if it is a close shot, then burns will be not present. Okay, because fire will travel only up to a certain distance. Okay, so if this is a gun, so fire will travel up to a certain distance, and this is the skin. Okay, so if it is a contact, then the burn will happen. If it is a close range, it is the burns will be not there. Then coming to intermediate, tattooing and bullet only will be there, whereas smoke and both smoke and burns will be not there. Okay, blackening and burns will be not there. Okay, that is intermediate. Then distant, from somewhere the shot has been taken. For example, let us take it is a sniper shot, then it is going to be only the bullet. Okay, that's it. So contact, close, intermediate, and distance. Okay, this is how you can determine. So this is previous year topic. Okay, please do not forget this. Okay, that's it. The gunpowder, it is an extra edge point that I'm telling you. So gunpowder, there are 2 types of gunpowders: black and smokeless. Okay, so black and smokeless gunpowders are there. There are a single base, double base, and triple base. Okay, so these are the types of gunpowder. If you want, you can learn it. Okay, that's it. Then this is with respect to the injuries. Okay, so now we are done with all the forensic medicine topics. Now we'll go on to toxicology topic. The important toxicologies I have discussed here. Please go through this. Okay, so why is toxicology important is, so we'll have to with respect to doctors, is why do we medical people need to go and like answer in courts and all, is because we have 2 duties. That is, one is legal duty and the other one is medical duty. Because after toxicology, after a toxic infusion, so they'll come to hospital and we'll have to treat them, and what happened after treatment and all, so we'll have to give to the court, right? So one thing is that, and the other one is legal duties. We will have to maintain all the decorum that happens with respect to the toxicology or poisoning case, whether it is a civil or a criminal poisoning that happened. All these things, that is our duty. So that is the 2 duties of the doctor. Okay, so next, now we'll go to the specifics of toxicology. One is corrosives. Okay, so what are corrosives? It is going to be acids or alkali. Okay, so acids, it will cause coagulative necrosis, whereas alkalis will cause liquefactive necrosis. We discussed about necrosis, right? Liquefactive necrosis, coagulative necrosis, all these things in general pathology. Coagulative necrosis, I told you, right? All the tissues. Okay, all tissues, whereas liquefactive, it was brain. Okay, so remember, right? So I told you, right? All the other tissues will be coagulative necrosis, where the brain will be liquefactive necrosis. Okay, so remember, and alkali is more dangerous than acid. Okay, so please remember that one extra edge point. And then coming to ethylene alcohol, so what happens is, it is the oxalic acid that binds with calcium, which will lead to calcemia and renal stones. Okay, in ethylene ethylene glycol poisoning, so what happens is, oxalic acid component will bind to the calcium and cause the hypocalcemia. Okay, so which might lead to renal stones. All the calcium has been bind to oxalic acid and it is being removed from the body through urine. So that is where the renal stones might happen. Okay, so remember this point with respect to ethylene glycol. So now coming to important poisonings that might happen in everyday life, that is arsenic poisoning, which will be seen in dye factories. All the dyes and all the, for example, let us take clothing industries. There all the dyes will be used, right? So this is where arsenic poisoning might come in. So the clinical features would be Aldrich Mees line, raindrop pigmentation, black foot, then cholera like symptoms. Okay, so remember all these 4 symptoms, it is very 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 important. Okay, so they have been asking only arsenic, phosphorus, all these things. Okay, so this is what they have been asking since many years, so that is why all these clinical features is very important. Please remember the garlicky odor, because even in phosphorus poisoning there is garlicky odor. Okay, so please remember garlicky odor. I'll tell you the difference later. Okay, then there will be muscle pain also. Okay, so remember Aldrich Meesline, raindrop pigmentation, black foot, and cholera like symptoms. Okay, so garlic odor is very important. Okay, then note that in skeletonized body also the arsenic remains. Okay, so in for example, suppose we are exhumation, there is an exhumation and we are determining a body. So if we are suspecting arsenic poisoning, it will remain in the skeletonized structure also. Okay, so investigation is Marsh test and Renish test. Please remember this. Then the management will be dimercaprol. Okay, that is BAL. Okay, dimercaprol. Okay, so that is the management that we do for arsenic. Then coming to phosphorus poisoning, it is seen in matchbox factories. Arsenic was in dye factories, whereas phosphorus poisoning is in matchbox factories. I told you, right, the clinical feature garlicky odor is in both arsenic and phosphorus, but the major point of differentiation is luminescent stool. They will be given, the question will be given with the luminescent stool. If it is there, then go for phosphorus poisoning. Okay, the management is copper sulfate. Okay, so copper sulfate itself is an poison, but in a lower dose we'll be using it for phosphorus management because it binds to copper sulfate. Okay, that's it. Then coming to mercury, mercuric poison, in BP operators, or the thermometers, old thermometers and all, we used to have mercury, right? So the management will be dimercaprol here also, just like arsenic. Okay, then coming to lead poisoning. So in paint factories, the paint they'll give in the question as a painter, long-term painter, or in the paint factory is the person is working. So then it is going to be lead toxicity. So here also it is going to be dimercaprol, BAL. Okay, please remember the only place where you won't use dimercaprol is in iron poisoning. Okay, so iron, okay, hemochromatosis and all, we don't use BAL. Okay, please remember there is no BAL in iron poisoning. Okay, Fe poisoning. Okay, is not there. So please remember that. Then coming to cyanide poisoning, cyanide, you know that, right? So fast acting poison. So what we do for management is sodium thiosulfate, sodium nitrate, and amyl nitrate. Amyl nitrate not anymore, but please remember the name. Okay, sodium thiosulfate and sodium nitrate. Okay, then coming to carbon monoxide poisoning, this can be seen in gas geyser users. Okay, gas geysers and all. So what happens is there is closed room and there is the person has been unconscious and they'll take the patient to hospital. So please know it will be carbon monoxide poisoning. The only management will be O2 supplementation. See, when we see the SpO2 of that particular patient, it will be always maintained at 96 or 98. It will be more than 95 only. But then what we'll think is the oxygen supplementation is not required. But the major and the most important management is oxygen supplementation only, because there might be hypoxia, and hypoxia might lead to brain injury. Okay, so that is why the investigation that we do is MRI. Okay, so MRI to determine the hypoxic regions in brain, but this is in the later stage. But the first management will be SpO2 will be normal, so please give oxygen supplementation. Okay, then coming to OP poisoning, our favorite topic since our third year, that has been OP poisoning, right? So organophosphorus poisoning, all farmers and all. So if it is a farmer that tell, and suddenly there was an insecticide or a pesticide infusion that happened, so it is definitely going to be organophosphorus poisoning. So here the management will be atropine and oxime, pralidoxime. So all these things. Okay, so in OP poisoning, the main thing is organophosphorus poisoning, there is increased parasympathetic system. Okay, parasympathetic meaning acetylcholine is increased. Okay, so the person will be relaxed, too much secretion all will be in the mouth, and all these things will be the clinical features with respect to OP poisoning. And one more thing is, there are things that I want you guys to remember. That is, there is immediate and on the third day, and after 3 days there will be OP poisoning symptoms. Okay, so immediately I told you, right, it is a parasympathetic system that is affected. So there will be increased secretions and all. So this is for a few minutes. Okay, so for a few minutes to few hours, this is the thing that the patient will present with. But after 3 days, what happens is there is something called intermediate syndrome, where there will be muscle weakness and all. Okay, so this is with respect to OP poisoning, there will be intermediate syndrome. Then the late syndrome will be muscular, not muscular, but neuropathy will be there. Okay, so these are the difference between the three classifications of OP poisoning. Okay, the treatment I told you, that is atropine and oximes. What we are doing is trying to decrease the acetylcholine. So how do we know whether the person is recovering from OP poisoning? Is, we'll see, the definite thing is we'll see the secretions. Okay, so it is not the BP or the heart rate that we see, it is the secretions. If the secretions are decreasing, then we consider that as OP poisoning patient is recovering. Okay, please remember this extra edge point. Okay, then coming to drugs that are very important, that they are asking is stimulants and deliriants. The two main stimulants are cocaine and datura, whereas the deliriants, alcohol, cannabis, and the opioids. Okay, so let us see the features one by one. Here in cocaine, so it is a sympathetic. Okay, so where the heart rate and BP will be increased. So cocaine, long-term cocaine users, you know that, right? The insect crawl sign and all will be there. We all learned, right? So this is coming in psychiatry. So long-term cocaine users, those things will be there. But please remember, it is a sympathetic where the heart rate and BP will be increased. Management is amyl nitrate. Okay, then coming to datura, the datura flower. Okay, please go and see an image of a datura flower so that you will be able to identify. Okay, so it is having a dry mouth and dilated pupil. Here also the sympathetic system is activated. That is why dilation of pupil is seen, that is mydriasis. Then dry mouth is there. So parasympathetic was increased secretion, whereas in sympathetic it will be dry mouth. Okay, so the management of choice will be physostigmine. Please remember this, physostigmine. Okay, so it is also an hallucinating agent. Okay, the datura. Then coming to deliriants, it is going to be alcohol, cannabis, and opioids. Alcohol, the management will be fomepizole. Okay, fomepizole and disulfiram. Please remember, disulfiram is used for as a it causes hangover, and what happens after hangover is the patient tells, okay, no need of alcohol anymore. So this is what we are trying to infuse in the patient in a long term alcoholic patient. So disulfiram causes the hangover like symptoms, whereas an antidote is fomepizole. Okay, so fomepizole is the antidote, but in an acute management it is going to be lorazepam. Okay, lorazepam or a benzodiazepine, that is used for acute management, lorazepam. And what we do is, if he's an hypoglycemic patient who has admitted to the emergency department, we'll give the diazepam, and then we'll go for thiamine infusion, and then we'll give dextrose. Okay, please remember this, thiamine will be given, vitamin B1, then we'll go for dextrose. Okay, dextrose fluid correction. Okay, it is not dextrose and directly, please don't give dextrose. It is going to be thiamine, and then dextrose will be given in an acute management. The antidote, the exact antidote is fomepizole. Okay, so remember that this is the difference between acute management and the antidote. Okay, please do not confuse between these two things. Then coming to cannabis, you know that, right? Weed and all, ganja, all the names. Please remember the exact names. These are all deliriants. Then coming to opioids, that is morphine. It is a pain reliever that that I told you, right? We used it in burns, also in general surgery. It is not for everyone that we use. Only for extreme pain, when the morphine is used. It is used as a medical management, but there can be morphine drug substance abuse and all. So then respiratory depression will be there. The management will be for all the opioids will be naloxone. Naloxone is the management. Please do not confuse with naproxone. This is naloxone. Okay, naproxone is given for headaches. Naprolet. Okay, so this is naloxone. Okay, then coming to heroin, this is also an opioid. This is of no medical use. If there is a substance abuse of it, we'll give naloxone. Okay, here also this is an opioid, so this is where we give naloxone. Then to reduce the addiction of these opioids, we use buprenorphine. Okay, please remember this, an additional point. Buprenorphine is added to certain drugs to reduce the addiction of it, because it is very addictive. That is why we use buprenorphine along with the opioids. Then coming to last point, that is the snakes and scorpions. Okay, in snakes there are two types of snakes, that is non-poisonous and venomous. Okay, non-venomous and venomous. Okay, so in venomous there is hematotoxic and neurotoxic. Hematotoxic is viper, whereas neurotoxic is cobra and krait. Okay, so what is the management is, if it is somewhere in the somewhere else outside the hospital, so always it happens outside the hospital only, right? So the procedure or the protocol that we all should follow and everyone should be taught is right procedure. Okay, so right stands for reassure them, immobilize, and get to the hospital and tell the doctor symptoms, tell the doctor all the symptoms. Okay, so this is the right protocol that all has to be taught. Everyone has to be taught this right. Okay, then coming to neurotoxic, so it is going to be cobra and krait, right? So the anti-snake venoms, after reaching the hospital, what the doctor does is, we'll see whether the person needs the vial anti venom if the patient has the symptoms. Okay, so that is when we give anti venom, anti-snake venoms. Okay, so the thing is, we'll give a maximum of 8 to 10 vials. Along with it, we'll be using neostigmine and atropine if needed. Okay, so this is the thing with respect to the venomous snakes, management of venomous snakes. So first we'll determine, most of them 99% will be non-venomous. If it is a venomous, it will be obvious signs will be there, so that is when we'll use vials. Okay, it is maximum of 8 to 10 vials that we use, along with neostigmine and atropine. Then coming to scorpion bite, so it is going to be increase in catecholamines, meaning increased adrenaline. Okay, so sympathetic activity is very high, so it causes high heart rate, high BP and all will be there. Okay, so the management of choice is prazosin. Adrenaline is being affected. Adrenaline acts on what receptors? Alpha and beta receptors, right? So alpha is the majority here, so that is why we'll give a alpha blocker, that is prazosin. Prazosin is the drug of choice. Okay, this is all and everything you need to know with respect to forensic medicine and toxicology. With respect to toxicology, there are some of the image based questions they might ask you. For example, the flower that is nerium, and there is something called kesari dal infusion and all. Regarding kesari dal, I'll explain in PSM, but now there are some image based questions which can be asked in toxicology. Please see those image based flowers, fruits and all in your toxicology notes or toxicology textbook. Okay, so this is all with respect to forensic medicine and toxicology. Thank you.